Hi everyone, this is Dr. Rajni, gynecologist, laparoscopic surgeon and infertility specialist from Care Vatsalya Women and Child Institute, Care Hospital, Banjaras. So today I'm going to talk about the most common topic, it is how to diagnose pregnancy. So we keep seeing in the old movies, whenever a woman gets giddiness, she falls onto the ground and they check the pulse and they detect pregnancy. I don't know where from it has come, but there is no such thing to diagnose pregnancy with pulse. So usually when a woman who is already having regular periods, or if it is irregular also, if those who are in relationship, those who are married or in relationship, once they skip the period, usually the cycle is from 28 days to 35 days. Once they have this delayed period or once they skip the period, they can go for a normal simple urine pregnancy test. So this urine pregnancy test kits are available in any pharmacy around the world. They can just buy this kit and they can test this pregnancy at home, just putting 2 drops of urine into it and checking the pregnancy. So sometimes what happens is there will be a dark line which shows pregnancy. Sometimes there will be a mild lines. Then they get confused whether they are pregnant or not. So when you feel that it is a mild line is coming and it's not thick, then it is the time that you consult your doctor, get yourself checked. Because sometimes what happens is when there is a pregnancy, it can be in the uterus or it can be an ectopic pregnancy. The pregnancy can be somewhere outside the uterus, it can be in a tube known as ectopic pregnancy also. In certain situations, we do a blood test also. So this blood test, we check for beta HCG levels. So it is also a procedure to know whether the woman is pregnant or not. So if we talk which one is better, a urine pregnancy test or a blood test, see, this beta HCG urine pregnancy test, it is routinely available in any pharmacy. You can just buy and go home and do it anywhere. And it is very cheap also, very economical. But this blood test which we do for pregnancy confirmation is definitely costly. You have to go to the hospital and get yourself, give blood sample and then check. And the report will take time. But in certain situations, we do this beta HCG test to diagnose ectopic pregnancies. In certain women, those who are going for assisted reproductive techniques like IVF pregnancy also. In such situations also, we do this beta HCG test for pregnancy, for the detection of pregnancy. So any women who are having regular periods, keeping their period, definitely they have to go for this urine pregnancy test. For a woman who is pregnant, there are certain symptoms like they may have more amount of, with symptoms also we can have a doubt regarding pregnancy, but confirmation is by urine pregnancy test or a blood test. But with symptoms also we can diagnose sometimes the pregnancy, like they can have breast heaviness, breast tenderness, they can have nausea, excessive amount of vomitings, they have this feeling of dizziness, weakness, fatigue. But for a woman who having all these symptoms, we can only confirm the pregnancy with a urine pregnancy test or a blood test for beta HCG. Then it is only the confirmation of pregnancy. And the final confirmation is with an ultrasound scan, looking into the uterus, whether the baby is formed or not, whether the heartbeat is formed or not. So that is the ultimate diagnosis is a ultrasound scan. Thank you.